just to be thorough, I'm going to look at like how the neck plays in and the shoulders play in. I don't know how important they're going to be in the grand scheme of things, but it could be, right? Because you are using your shoulder a lot when you're swinging. So let's just be thorough and look at the whole darn thing, right? Now, all these tests, I want you to keep your feet together because it's going to standardize everything so that when I test you again, I know I'm doing it the same way. Okay, so good. And all I want you to do in here is you're going to bring your chin right down to your chest. Come right back up to that one more time. I'm going to look at that motion. Good. You get all the way down. Your neck has like a uniform curve. That looks great. Okay. You should like basically be within 10 degrees of parallel of the ceiling. You're a little shy of that. Does that give you any discomfort?
I feel just the pull here.
Okay, I'm just going to write that down. So yeah, you feel it in the front. Typically with this stuff, like let's say you were to feel it and be like, yeah, I feel like in the back. That would tell me it's more of a joint restriction. Yeah. When you feel in the front, that's more soft tissue, right?
It is soft.
Right. So that's going to be something I'll write down just in case. We'll have it in our back pocket for later. Okay, now from here, so you're going to basically just rotate your head as far as you can left. See, you kind of brought your torso there. Try to keep your torso perfectly still. Go ahead and turn your head as far as you can. So your nose, this is the midclavicular line. Your nose should pass that line or touch it. You're not quite there. I don't think it's too big of an issue, right? It doesn't seem like a glaring issue to me, unless one side's really good, one side's not. But let's just see. Turn as far as you can to the right. Maybe it is. Get back to neutral. What I noticed on that was instead of you just getting rotation, you're actually doing like this. You're kind of tilting your head.
Well, I guess I wasn't trying to do it.
See how far you can get just keeping your head straight. Feel kind of hard?
It felt kind of difficult. Yeah.
Okay, so what that tells me is, so basically the top of your neck, it's made up of like basically a washer. It's designed to rotate. If you're ever tight in the top of the neck, what your body does is it borrows from the bottom of the neck. And the bottom of the neck has joints that are at 45 degrees. And what happens when you use those ones is your neck tends to tilt because it's not a perfect 90-degree thing, right? So we're going to take a look at that if we have to after. It's definitely in my back pocket. So we go right rotation. Definitely we don't want to look at. Cool. From here. So we know so far I might want to look at this. Might want to look at rotation if they show up as the only things. Now let's see how the shoulders play in. So we'll check the first motion of the shoulder on your non-dominant hand. So what is that? Your left? Okay. Bring your left hand behind your back and touch that opposite shoulder blade right at the bottom. Do that one more time so I didn't see behind you. Back to neutral. Okay. You know what? Just try to get your hand right to here. Just try to do it in a nice, swift, easy motion. Just try to get right here. You got a little bit of that like tough motion.
But this one's going to be worse.
Okay, let's see the other side. Now that one, you're like going like this, moving your torso. Try to keep everything else straight and just move your shoulder. Yeah, that looks very tough. Okay, back to neutral. Okay, so that's something worth looking at. Now, with the shoulder, when there's an issue in the shoulder, we never actually look at the shoulder until we can clear your upper back. That kind of trumps everything, is if your upper back's not moving, we don't even treat your shoulder yet until this is good, right? So let's try doing your left hand. You're going to go same thing, over top and just touch right there. I don't hate that. How did it feel? Looks a little tough to me, but let's try that other side after. Yeah, do one more. Right? It doesn't look like a nice, easy motion. It looks like you're kind of struggling to get into there, but it's not the worst I've seen. Okay, let's try the other side. Does that feel harder? It looks harder. Yeah, it looks harder. It looks like something's going on more in that right shoulder than your left.
I feel like I have to lean my...
Yeah, and that's actually one of the criteria we're looking for, is if you have to bring your head forward, that means you need thoracic flexion in order to get your hand up, okay? Yeah. Okay, so good. We know that, we know I got to look at your right shoulder with both up and down. Now, the whole idea, just so you can kind of understand what we're doing here, is when I'm looking at this, in order for you to get your hand behind your back and touch your shoulder blade, you actually need 3 different motions in the shoulder. You need extension, internal rotation, and elbow flexion. I'm going to look at all 3 of those and see what the issue is. You kind of get, it's like a 40,000 feet.
Do that again?
What's that? Yeah, no, you're good. I'm going to look at that. So now we're going to look at these bigger motions. So the bigger motions, arguably, I think are more important. So we're going to start with flexion, which is basically a toe touch. And you know what? Don't worry about how flexible you are. It's not just, let's see what's going on, right? Keep your legs straight.
Yep. Keep
your eyes on your toes to keep your head pretty neutral. Yep. And then you're going to go down and just kind of, that's it. Let's stop where you feel comfortable. There's no judgment here. It's just whatever happens, happens. Come right back up. First of all, what'd you feel?
Pulling here.
So pulling down the leg.
Yep.
Right? We want to see that when you're doing this, your bottom half works as good as your top half, right? It looks like your top half here, remember we talked about how this is supposed to be a very stable joint, but it loves to bend forward. It looks like yours, for some reason, when you're standing, doesn't love to bend forward. It looks like the top of your back is doing all the bending forward and the bottom of your back staying kind of straight, right? So you kind of got this part right here is not really, this is where all your flexion is, kind of staying straight right there.
Exactly.
right? So like, I'm going to dig into that. See, okay, why is that happening? Is it because you're just so tight in that whole chain behind you, or are the joints too tight? Or I don't know.
Yeah, like I've never really been able to touch my toes.
Yeah, well, let's figure out why.
Yeah.
Like it could be just because of hamstrings. Who knows? I don't know. We're gonna know by the end. I don't know.
Yeah.
A lot of things can cause that.
Yeah.
So okay, good. We got that. I got to look at that. No pain though, right?
No.
Perfect. Yeah, the ones I'm interested in are the ones that are not painful. So from here, let's have you check extension. So extension, same thing. Feet together, hands come up to the ceiling, and then you're basically just doing a back bend, bringing your hips forward and your hands backwards. Okay, back to neutral. How did that feel?
Oh, fine.
Not too bad, right? That's lower down on my priority list.
It took a bit of like effort.
Yeah. Like you weren't perfectly like uniform in the back, but it wasn't crazy. You weren't hinging from anywhere too bad. I didn't hate that. Okay. Now let's check your rotation. So with rotation, I'll kind of show you how to do this. Keep your feet together. Lead with your head. Turn as far as you can, and then bring your whole body as far as you can into rotation. Okay, one thing I didn't mention. Sorry, that's my bad. Bad coach. Typically, we'll want to lean this way or side bend. Yeah. Try to keep everything stacked and turn as far as you can left. Right. Okay. See the other side. That's good. Do you feel pretty good there? Okay.
That was harder.
Yeah, it looks a lot harder. Now with you, for sure, there's definitely discrepancy between sides. Your right rotation definitely isn't great compared to your left, but they're both not meeting par. What you should get with rotation is 100 degrees total rotation without resistance, right? Yeah. You're probably getting 80. Yeah. So what should happen is 100 degrees would mean if I turn all the way right, my left shoulder pops out because I'm past 90, right? Yeah. Right. So you were getting like going to the right, probably way less than half of that. Yeah. Right. Whereas your other way, you were a little better, but still not getting to that 100-degree mark. So the way I also want to explain this too is when you rotate, you should get rotation all from the mobile joints pretty much, right? So your upper back should get about 50 degrees, this should get about 50, and your ankle should get a couple of degrees. So we're going to break those out today for sure. Okay? I think the most aberrant one was your right rotation. Yeah. So when you play squash, I guess it'd be you're right-handed like me. Yeah. So it'd be when you're on your forehand would be the biggest issue, would look like for me. Or if you're playing tennis, going like forehand and across, but you don't get it as bad. Yeah. But your backhand, your left rotation. Yeah. Well, they both could be causing it, but I'm just like I'm interested now. I'm like I want to see what's going on. So let's break it out. So come follow me. Let's go back to the room. Okay, let's do this. This should be fine. This is how we're gonna start. I'm going to start by isolating your upper back and seeing if it does its job. This one's pretty simple. It's a weird position, but this is how like we do motion studies like in the lab, and well, I don't, people do. And the best way to isolate your upper back is this position. It's called the lumbar lock. So you bring your butt to your heel, you bring your arm down, and that's me. And bring your hand here, left hand behind your back, right hand behind your back. And you're going to turn your head first, kind of like we did, and then see how high you can bring your shoulder up. Here's the thing. You're going to want to bring your butt out if you're restricted, right? That's the main compensation. So try to keep everything straight. And right when you like be honest with yourself, be like, okay, this is where I feel like I want to bring my butt out. And then that tells me where you're at. Okay. Let's put that in the middle of your body. Yeah, perfect. Put your right hand behind your back. Good. Keep your butt down. Yeah, that's perfect. Now, see how you're all kind of in a line here? And that barrel, if you bring your butt out, it's going to touch the barrel, and the barrel's electric. Okay. So you're going to keep in that position. Yeah. So that tells me a lot. If I can keep this really relaxed, I think I can.
Yeah. That's pretty comfortable.
Yeah. So you know what? If I can bring you further than you can bring you, you just don't know how to use it. Oh, okay. That's called a stability problem. Okay. Right. So have you ever heard people say I have a stability issue or a motor control issue, but not on the table? I can't fix that. I'll teach you how to fix that. Right. Let's see if the other side's different. Go back to the beginning. I want to see something here. So I'll just get a quick little measurement. Go ahead. So out of 50, that one's 25.
Oh, what?
Yeah, that one looks really restricted. Let's see if I can get you any further. Does that feel uncomfortable? Let's see, you can relax your body. Now that's interesting. Looks like I can get you as far as I need. Yeah, okay. So you have a bigger stability issue or a motor control issue on that left side. But you know what? That's not what I'm really looking for right now. Because when you're playing, right, like even if you can't actively get there with your muscles, throwing your body will get you there, right? Like, whereas there's somewhere along the chain for sure that doesn't have the mobility. So let's keep looking. Let's go face down, please. On the table there. Okay. See this? This one's amazing. So your right hip Unbelievable. That's like athletic as hell. This one's got a little bit of like resistance to it, right?
This one's definitely a tighter.
So I want to see how you move these on your own. Let's just see without, so by the way, if you lift your hip up when we're doing this, that tells me during this test, you're not using your back, or no, you're not using your hip. So I want to make sure we use just your hip. So if you feel this start to lift, you're kind of done. So let's see how far you can drop your foot that way. See how you're kind of lifting that up? Bring that back.
Yeah.
Let's try that again. Hold right there. You lifted right there, right there. Okay, hold that. Yeah, you know what? You're just good there, actually. You're actually okay. Let's go to the outside. You know what? Each of your hips is actually good enough. Like this one's good enough. So you actually have enough mobility where I'm like, I'm not worried about it. But that leads me to now check the last thing, which is your ankles. So now we've kind of ruled out that a big problem, like at least mobility wise, isn't your upper back, it isn't your hips. You have a stability problem in your upper back. We got to definitely address that. But I wonder if that's the biggest thing. I have a feeling maybe it's not, but we'll see. Could be just a stability thing, right? So which is easy, which I don't have to do anything really on the table. That we're just going to teach you how to use your back again, right? Keep this relaxed. Okay. Really the best. There's no motion there. So if I was to keep everything together, try to rotate that ankle in, there's actually nothing. You should get about 20 degrees. Nothing. I get 40 that way, which is good. Nothing, like literally nothing. You have no motion there. That's a problem, right? So I can't push it at all. So let's check. That's a major thing. Yeah, totally, right? You should be able to, because it's a closed chain. You're planting your foot down, and you need to go like this. If you can't plant from there, what's going to happen? Well, you're going to start using your back a little bit, right? So really good, right? Isn't that crazy? Okay. That's what I'm. This is why we look at these things, because I'm like, okay, how else do you find that issue if you're not looking at the whole chain? So we got to fix that for sure, right? That's a mobility issue. I can't move it, and you can't move it, so we got to get it open, right? So cool, that makes sense. We identified probably a big problem there, right? But let's keep looking. So I know that you were really bad at doing that motion too. I'm just going to look into that, see what's the issue there. Okay, let's check the hamstrings first. Or you know what? When you can't touch your toes, sometimes it's people are not very good at using their stability, and what happens is their back tightens up because they're using too many muscles. We're going to change the stability requirements. Basically, I want you to sit up here, scoot your butt back a little bit. Yeah. Just try to touch your toes here. So you still can't, right? So let's have you lay on your back now. Sorry about that. Okay, so you are going to do me a favor here, and I want you to keep this knee down. The minute this lifts up, test is over, okay? This one's going to stay straight, but lift it as high as you can up in the air. Kind of like that test we did at the beginning, right? Where I tested your leg. Yep. Same thing, right? So relax your body, try to keep this one down. The minute it stops making contact with my hand, test is over. Okay? Yeah, exactly. Yes. Normal here would be about 80 degrees, right? Let's see if I can bring you any further. No, like where you get is where I get you. So, good. So you're really tight in there. That's posterior chain, we call it. Yep. It's made up of like the glute, the hamstring, the calves, the plantar fascia. That's all part of the posterior chain. Let's have you press into my hand here again. Good. And just lift that as high as you can. That one's better, for sure. So there's definitely a discrepancy between your left and your right. Let's see if I can bring you any further. That one's actually okay. Okay. Like that one's fine. Whereas this one here, yeah, I don't love that. No. And then like that tells me there's like, you never want to see a big side-to-side difference. We got to probably even those out a little bit.
I know that this definitely is very tight.
Yeah.
Like when I'm stretching it, the pull is way more than this one. And then the last thing I want to see with this is if we add core stability, does it get better? Okay. Yeah. So this is what we're going to do. Just with your left side, bring your hands up towards the ceiling. So hands like this, like this, okay, up towards the ceiling, like that. Good. Elbows straight. I'm going to try to push your hand back. Don't let me. Okay, ready, hold. That's going to be how we activate your core. And then you are going to lift that leg up as high as you can again. Go ahead. Go back to neutral. So really, it's actually not a length issue. You got way better the minute I stabilized your core. Oh, yeah. Okay.
So that tells me probably more, if we'll have way better of an outcome if we actually address your core for this type of movement than if we start stretching you. Stretching you won't do much. Okay. Right? Does that kind of make sense? Gotcha, yeah. So, kind of makes sense? Yeah. So, I'll show you like a really good exercise for this. Give me 1 second. I'll be right back. Okay. So, I'm gonna have this kind of around my neck. You're gonna take these and you stay right there. You're gonna bring them right down by your side. Okay. Grab these.
You grab the rubber part, yeah, good. And then push them down by your side. Go ahead. Okay, do that. You're gonna start training this.
This is better.
Keep that leg up, keep that left leg high, and then slowly bring down your right leg. It's called leg lowering with core activation.
Oh yeah.
You're gonna do this at the gym a couple times a week. Or if you want to do it like once a day, that's even better. Then obviously you switch sides after, but that's the idea.
Okay.
Okay, and that because that's your main issue is core activation, right? So that's how you start to fix this.
Yeah.
Does that make sense?
Yeah.
Okay.
I have resistance bands too.
Perfect. Yeah, that you can anchor these to something. You can use a cable machine. You could do whatever, really. Yeah. So you could like push onto something. Like if you had a bar, you could just like we did at the beginning, push onto that bar to get your core active and lift your leg. Anything really. So just MacGyver it. But there's no special exercise, but that's the mechanism to getting your core strong while you flex. The reason that happens, it's actually pretty interesting. It's like so when your core is in a better like at rest, if you have a better core activation, well, you actually put your pelvis in a better position because your core kind of like when it's really weak, it sits like that. That is the position.
Why would that be any different than doing crunches?
Well, it's not really, but it doesn't add the thing you're bad at while you try to stabilize your core. It's like we know your hamstring there probably is adding to that back pain. It's never just one thing, right? You're not probably engaging your core the way you should. So what we're going to do is engage your core, flex your hip, and teach your brain that pattern. So that's why it'd be different, right? But it's still good to do your core. But now that we know why you're bad at that part with the core, it's that one thing lifting your leg up like that or bringing yourself forward is when your core is not being very good.
Right.
So why not train that one thing since we know how specific that is, right? Okay, cool. So that's number one. We got that. Number two, I got to get your ankle moving to internal rotation. That's basically your backhand. Yeah. When you're rotating, you have to internally rotate your right hip. Yeah. You can't do that. So you're probably compensating somewhere along the chain, and I'm guessing maybe that's going up towards your back. That could be another mechanism, right? And then the last one is you have a stability problem in your upper back with rotation. So that's even more probably adding to your low back because stability-wise, your body doesn't know how to turn left. Right. Or turn right, sorry, with your upper back. Right. So you got these kind of like perfect storm. Perfect storm. Interesting. As long as it makes sense to you, sure. I'm happy. Let's treat it. So the only thing I need to do on the table really is your ankle. Okay. We're going to open up your ankle and then we're going to see if it still rotates. If it does, good. You just keep it going. I'm going to give you a little thing to do every day. If I open up your ankle successfully, you're going to just basically mobilize your ankle every day. Okay. That's it. Cool. Okay. That's how simple this is. So it's got to give you some exercises. We're going to give you those exercises, and then when you come back, we're going to test them out here. We'll test out your motion again, make sure you're actually getting better. And if you are, we're on the right track. And then what we'll see, if we're doing the right thing, is that your pain will get better and better and better throughout the weeks. There's no quick fix. Yep. This takes time, just like anything. But as long as you know what to do, like hopefully you probably won't see a change for 6 weeks. Yeah. Right? Okay. That's just like if I said, go do bicep curls. You're not going to be Arnold tomorrow, right?
But I should still do whatever.
Yeah, don't change any of your routine. I want you still working out as much as you do. Just add this, right? Work out more even. I don't care. Like that's even better. Okay, cool. Come take a seat. We're all good. Sorry, 1 second.